During the COVID-19 crisis, the country has been dealing with a severe blood supply shortage.
But as medical reporter Dina Bair explains, a blood service provider is now giving potential donors even more incentive to step up.
On the Medical Watch, a 2-for-1. Give blood and learn if you have antibodies against SARS-CoV-2, the virus that causes COVID-19. A local blood center is offering the screening to those who step up to save a life. The blood was pumping at Vitalent's Jefferson Park Collection Center this afternoon. A good sign, considering the nation's supply is critically low right now.
Summer is a difficult time of year historically for blood collection. People get busy, people want to be outside, not inside. They get busy with family things. So blood collection goes well down. It's one of our toughest times.
Most were regulars who turned out today and a few first-timers. But all the donors who rolled up their sleeves walked away with more than the reward of performing a good deed.
What we've added to our normal screening panel is the ability to test for COVID-19 antibodies.
The blood supply is screened for a variety of diseases and elements. Now add SARS-CoV-2 antibodies to that list. It's a perk designed to boost donations and ultimately stock the shelves with convalescent plasma, a potentially life-saving therapy doctors administer to sick patients to help them fight COVID-19. News of the added screening went over well with George Birmingham, a longtime donor.
I don't think I have it, but always kind of curious, like to know for sure.
Kathy called the antibody testing a bonus.
I thought it was interesting to find out that whether being out in the public or whatever if I do end up with the antibodies.
It is a little like a summer promotion. It's, I'll say, a little more important than a t-shirt, a little less visible.
The extra test, which is FDA authorized, is free, and donors are notified when they have the antibodies about 2 weeks after giving blood.
Once a donor does come up as positive for COVID-19 antibodies, then we do, yes, ask them if they would like to be a convalescent plasma donor in the future. There is a good demand for convalescent plasma, not what it was a month ago, and we're very thankful for that. We actually wish no one needed our blood products, but there is still a need there. People are still using it.
The test results are shared with medical researchers who hope to learn if those who carry the antibodies are protected from the virus and for how long.
I wouldn't say we have a stockpile of convalescent plasma. I would say that we have some of it. We're definitely in need of more donors to ensure that it's on the shelf when that patient is admitted to a hospital and needs it right then and there.
So far, Vitalent has distributed 200 units of convalescent plasma to hospitals all across Chicagoland. And blood donations of all types are needed right now, especially type O, A negative, and B negative red blood cells. You can learn more about donating and getting your free antibody test on our website. Back to you.